is one of the most important videos to watch because we're going to go over exactly what you need to know to stay healthy and avoid injury. The biggest thing you need to be aware of is the 4 key principles. And then from there, we're going to break down the nuances of how to exercise safely. You cannot do any high intensity exercise if you have any of those 3. So you can still exercise, you just don't want to be doing high intensity exercise. If you're immunocompromised, have low red blood cells, red white blood cells, or low iron. No high intensity exercise. After that is you don't want to add weight to areas with metastases. So an example would be if you have metastases on your hips, you don't want to do deadlift, squat, or running, for example, or jumping, because those are exercises that put a lot of weight on the hips. You can, however, do a leg extension. That's where you sit back and you kick your legs forward, or you could also do a leg curl where you bring your feet underneath kind of where you're sitting. Those 2 exercises don't add any weight to the hips. Another exercise you wouldn't want to do if you had, for example, metastasis on your hips, you wouldn't want to do a leg press because that's the weight and the force is coming directly on your hips. So you want to avoid exercises that target or put weight on the area with metastasis. That's a big, big no-no. Obviously, you have to be mindful of all these things, but when I'm working with my online coaching clients, I'm doing all this for them. I do all the thinking for them so that they don't have to. The third thing I look out for is how much weight they need to be putting on areas that are sensitive. I'll give you 2 examples. Number 1 is if you have a port, you need to know how much weight you can be using if you have a port. What's going to happen is your doctor's going to tell you no more than 6 or 10 pounds. Now, that's probably what the surgeon is going to tell you right after surgery or right after it's put in. Once you are cleared, so 6 to 8 weeks afterward, they might not have any limitations for you. So make sure to ask again. I actually have an online coaching client who's a power lifter, and she can put on as much weight as she wants because her body can handle it. And her oncologist said it's absolutely fine. It's not going to affect her at any way, shape, or form. I don't know what device you have on, or you need. So it's very important you talk to your oncologist to see what the limitations are for you. But be mindful that once they put it in and, once it's healed and the wound's closed, you might have different limitations. Okay. The other example is if you have a line in you, right? Then you need to be aware of how much weight you need to put on then, or how much weight you can put on at that point, right? So sometimes the oncologist is going to tell you no more than 6 to 10 pounds. From what I've seen working with different oncologists, that's kind of the range that seems pretty common, but they might give you a different range. Maybe you might be bigger or stronger, or maybe you might be a little bit more frail, less muscle. I don't know. You got to talk to your oncologist about that. So make sure you're aware of what the limitations are. Same thing goes for lymphedema. So if I'm working with somebody who has lymphedema, I need to be aware of when they got lymphedema. So maybe are they right after surgery and they're starting to get increased risk of lymphedema, or they're showing signs of lymphedema? You don't want to add, more than 10 pounds. Once you are cleared, though, there is no upper limit for lymphedema. If you have lymphedema, I have a whole video talking about how to exercise safely with lymphedema, but that's one of the cases where there's a very specific considerations to be mindful of. So go ahead and watch that video. I'll have it in the description below as well. And then the last thing is make sure you're cleared before doing any cardio if you have any arrhythmias. So this is very important. Some chemotherapies, usually the stronger ones, can cause heart disease. So it can cause arrhythmias, it can cause some ventricular functions, and you need to be aware of the risk you have for the chemotherapy that you're taking for heart disease. And you need to be aware of what your limitations are if you do have that. With that being said, you're going to need to talk to your oncologist, but also probably a cardiologist to make sure that it's controlled. If you do have an arrhythmia, for example, that doesn't mean you're never going to be able to exercise. So for me, myself, I used to work in cardiac rehab, and I helped people exercise who were right after a stent, open heart surgery, arrhythmias, bradycardias, any different issue or heart condition. There's definitely ways to still exercise even afterward. You do want to make sure you're working with a trained professional, clinical exercise physiologist, and cancer exercise specialist. With that, there might be a period where you might not be able to do cardio. That doesn't mean you can't do Maybe yoga, tai chi, lifting weights is even fine to do, as long as you're not doing, circuit training or high rocks or something like that, where you are lifting weight against the resistance, but it's, your traditional bodybuilding is not going to increase your heart rate that much. That should be fine to do, but once again, make sure you are talking to your oncologist, because that's extremely important. Now, there are more things to consider, and I put that list down in the description below. So please go ahead and read through that, because they are very specific. That doesn't generally apply to everyone. Okay, so make sure to check that out afterward. Let's get into the practical application. The first thing that you want to do when you are looking to exercise is warm up. Whether you're in treatment or out of treatment, you want to make sure you're practicing what's called the 10-minute rule. If you don't have a general warm up that you do and that you practice, the 10-minute rule is the best place to start. So, what it is that you take 10 minutes, and this helps specifically if you have fatigue, by the way. You take 10 minutes to just get up and start walking. That 10-minute walk is going to let you know whether your body is ready to exercise. After 10 minutes, if you feel good, the same, or better, keep exercising. And then you can readdress every 10 minutes or so to make sure you're feeling good. If after your first 10 minutes, or maybe your second bout of 10 minutes, you feel bad or just worse, stop exercising and go rest. Those 10 minutes are crucial to make sure you overcome cancer fatigue, but also make sure that the exercise is not going to make you feel worse. The best general warm up that you can do is just a 10-minute walk. Now, after the general warm up, you want to make sure you're progressing slowly. That sounds, once again, like very common advice. But what that means is anywhere between 1 to 5 pounds of weight increased weekly or every other week. The reason it's a pretty big range is because it's going to depend on your body. If you have lymphedema, for example, you might only be able to do 0.5 pound to 2 pounds of increase if you have lymphedema on the arms or on the legs. It's going to depend. It's going to vary. Now, the reason it also varies is because your legs and your arms can also do different amounts of weights. Your legs are going to be able to progress much faster than your arms will, for example, or your shoulders will. So there's a bigger range. You might even be able to go up 10 pounds on your legs. That's not uncommon. I've actually seen that before. So that's very, very common to see, especially if you didn't have any surgery on your legs. Maybe you were a previous athlete, you exercised before, then you can see a big jump like that. But generally, if you've never exercised before, 5 pounds per week or every other week. And what I like to say is if you can do the same amount of weight for the same amount of reps 2 weeks in a row, it's time to increase that weight. Okay? Now, in terms of how hard or how easy the exercise should feel, what I like to suggest is variability throughout the week. So your week to week should look the same in terms of exercises, because number one, that's how you're going to progress to get better, and number two, that's going to keep you motivated. If you do different exercises every day, different exercises every week, different exercises every month, you're never going to see progress, and that's going to demotivate you. That variability is fun, but you can't know if you're getting better. So your workouts daily should be different, weekly should be the same, and then be changed every 4 to 6 weeks. Okay, so month to month it should be different, and month to month you should be getting better. So the exercises should be getting harder. Now, within that week, even though every single week it looks the same, within that week you're going to have some days that your exercises are harder, some days that your exercises are easier, because there's going to be a focus for that month, right? And that focus is what's going to help you grow and get stronger and get better. But it's also going to prevent overuse of injuries and um, making sure that your body still feels good. So maybe 1 month you focus more on your legs. Maybe the next month you go a little bit harder on your arms. And what that's going to do is on the month that you focus more on your legs, for example, your arms are going to get a little bit more rest. You're still doing exercises for your arms, but you're not going to feel as tired on your arms as you would on your legs, and vice versa. You also want to have variability throughout the week. So some exercises are going to be much harder than others, not just because of the focus, but because of your energy levels. So this advice is specifically for anybody in treatment. So what I'm about to say is specifically in treatment. If you're in treatment, you want to make sure that you have plan for hard days and easy days. If you feel like crap, you can't get out of bed, you're sick to your stomach, you have no motivation to exercise, those are the days that you do the easy exercise. If you feel on top of the world, like you can crush it, full of energy, those are the days you want to do the harder exercises. Mentally, you're preparing to do both. Have easy days and have hard days. Even the best athletes in the world have a variation between intensities. So it's important that you have a variation too, and that you don't set your expectation up for failure, because if you set yourself up for failure, that's going to affect your motivation and also your ability to continue to exercise. So the way you exercise and the way you go about it is going to determine your motivation as well. If you say I'm going to work out 6 days a week and your fatigue doesn't let you, now you feel like crap, you feel like a failure, like you're a loser, like you suck, like, oh my gosh, why is this happening to me? You're probably not going to exercise the next week. But if you set yourself up for success by saying, I'm only going to exercise 2 days, those are going to be lighter days because maybe it's a chemo week. Now, by the end of the week, you did your 2 exercises, you feel like a success, you feel good about yourself, you're more likely to exercise for the next 2 to 3 more weeks. Okay. So that's important too in terms of motivation, but it's also going to keep you safe and comfortable, right? Throughout that time, you're not going to be too sore where that also bothers you. All right. Now, the next thing is going to be how much rest you need. Your body still needs to rest. During treatment, out of treatment, with exercise, without exercise, your body still needs to rest. So, what I always recommend is 24 to 48 hours between the same muscle groups of rest. So, you need to rest. Let's say you work out legs on Monday, you should not be hitting legs again until Wednesday at the earliest. Should be Wednesday. Now, you can still exercise Tuesday, but that should be upper body exercises, because you can do lower body one day, upper body the next day. That's absolutely fine. What you don't want to do is lower body, lower body, lower body. Now, with cardio and core, it's a little bit different because your body can recover a lot faster. So you could do a little bit of core today and a little bit of core tomorrow. That's absolutely fine. If you are sore, do not exercise the same muscle group. Generally speaking, that's a good principle to follow. But you can exercise muscles that aren't sore. So that's absolutely fine as well. Now, cardio, once again, it's a little bit different because you can still run or jog or walk every single day. What you want to change is your intensity of that run or that walk. So maybe one day you do a light walk or a light jog or a light run. The next day, you might do a brisk walk. The day after that, you might try jogging. The day after that, you might go running and do some interval trainings, right? But you're changing the intensity of that throughout the whole week. Another great thing to do if you enjoy this, you don't have to do this, but if you enjoy this, is you can do different modalities or different modes of exercise. So, for example, maybe you do water aerobics one day and you do a brisk walk the day after that, and then you do swimming the day after that, or maybe you get on the elliptical. That variation, even though it's still cardio, is going to reduce the amount of strain that the joints do throughout that same time. I only recommend that if you're doing 45 minutes of cardio consistently, though. Now, you can also do that if you just like variation. As long as you're getting your cardio in, that's all that matters, really. If you're looking to start running or maybe get back into jogging or anything like that, the best and safest way to get started is with a 1-to-3 ratio or a 1-to-4 ratio. You want to do 1 minute of high intensity. And by high intensity, I just mean running or jogging, something that gets you out of breath, and 3 to 4 minutes of resting. And by resting, I mean just a leisurely walk. You can also walk really fast and sit down for 3 to 4 minutes. That's absolutely fine too. But in general, you want to do 1 minute of like a run or a jog, and then 3 to 4 minutes of a walk, a light walk. And over the course of a month or 3 weeks, generally 3 weeks to a month, you're going to increase the amount of time you're running or jogging until it reaches a 4 by 4. It means 4 minutes of running or jogging and 4 minutes of resting, which would just be your walk. That is going to be the safest way to exercise and do cardio. Too many people try to do too much too quickly. They get discouraged, they get shin splints, aches, pains, soreness, and then they just stop exercising altogether. But if you focus on that progression, you're going to find that you're going to be more motivated, but also you're going to have less aches and pains because you're going to see progress faster and you're going to reduce the amount of stress that your body feels. Another thing that's very important in terms of how much you're exercising is to work below the threshold of pain. What I mean by that is your joints, depending on where you had surgery and the muscles that were affected, the areas around it, you're going to have a different range of motion on your shoulders, your neck, your chest, your legs, your hips, your knees. It's all going to vary. I'll give you an example. I had somebody who he could not raise his hand above this high on his shoulder. He had a shoulder injury before he started working with me, and that's all he could do. So he had issues, for example, putting on a hoodie. All I did was work around the different ranges of motion that his shoulder allowed him. So his shoulder could go back, his shoulder could go forward, it could go to the side, it just couldn't go up. And all we did is exercises like, for example, a wall push up, a lateral raise, and a rear delt fly, because that strengthens the muscles around the shoulder without affecting the upward movement. But we also did exercises that forced that shoulder to go a little bit higher, slowly but surely. We only did rep ranges maybe this with this much range of motion because there was no pain, and slowly but surely he was able to do more range of motion without any pain until now he can get up off the ground, put a hoodie back on, and go about his life without any aches and pains on his shoulder, which to him felt like a miracle because he actually didn't even notice until he put a hoodie on, and his wife's like, oh my gosh, you just did that without any pain. And he's like, he was shocked, right? Because he didn't even notice it. But that is one way that you can work within your pain threshold in your body. So you shouldn't feel sharp pain. You shouldn't feel pulling. You should not feel like aches on your shoulder, like on the joint. You should only feel maybe a slight burn or a burn on the muscle, the meaty part of your body. If you have arthritis, you may not know how intense that exercise was for you until after your workout. It's very important that you don't feel pain during the exercise, but you also don't feel pain after the exercise. If you feel aches 2 hours after your exercise, then there was too much pounding on the joint, too much intensity, or the exercise was too hard for your body. And you need to reduce how long you're doing that exercise for, how hard you're doing that exercise, or you need to do less reps for that exercise. For example, if you are be jogging, then you would need to only walk till you can do walking without any pain. But you might notice that walking for 20 minutes bothers you. So only train for walking for 15 minutes and work your way slowly up to 20 minutes. As long as you backtrack, you're going to be able to move forward, but you can't just keep trying to push those limits. That's going to be worse for your body and you're going to be in aches and pains afterward. If you have any questions about that, please go ahead and leave them in the comment. I'm more than happy to answer that. So we've talked about the range of motion. We've talked about pre and post surgery, how that can be different. The last two things that I want to go over is hydration and eating enough protein. These two things are key to making sure that you feel good during and after. So to give you an example, if you do the same exact workout, but your body is dehydrated, that workout is going to be much harder to complete. So if you have fatigue, if you don't have motivation, if you're struggling to exercise, you feel weak, make sure you're hydrating and eating enough protein because it's going to fuel your workout to make it feel a little bit better. If you are running, maybe you're a marathon runner, maybe you're doing strength training, protein is going to be very, very important in this case. All right. So hydration, all you need to know is if your pee is clear or a little bit yellow, you're hydrated. For protein, 15 to 20 grams of protein before and after your workout. That's going to help you fuel your body before your workout and after your workout. And then you also want to pair them with a little bit of carbs. So a lot of people hate on carbs, but your muscles have what's called glycogen, which is basically stored sugar. And they use that stored sugar during the exercise to make sure that they can do the exercise appropriately and they can do it efficiently. So that's why it's important to eat sugar, not sugar, but carbs afterwards. So that way it goes into your muscle, not, around your fat, goes into your muscle. And next time you exercise, you're going to have the energy that you need. So hydration, rest, which we've talked about earlier, and protein is extremely, extremely important. Obviously, I do all of this for you in my online coaching program. But if you have any questions, feel free to put them down below. And I will have more videos coming up for you soon. Have any comments on what the next video should be on? Please go ahead and let me know. And I have a free workout guide in the description below. I'm JC, cancer exercise specialist and clinical exercise physiologist here at Oncology. Take care.